As warmer weather occurs, we tend to spend more time outside under the hot sun. When being exposed to high temperatures, it's crucial to identify any health concerns caused by exposure to excessive heat. The main cause of heat-related illness is your body's inability to cool itself. Sweat is your body's natural tool for cooling you down. If you exercise or work strenuously in hot weather or a heated room, your body may have difficulty producing enough sweat to keep you cool. You may have heard of the terms heat stroke and heat exhaustion, but it's important to remember that these terms are not interchangeable. Knowing the signs and symptoms of these two conditions could save your life or that of a loved one. But what are the differences between heat exhaustion and heat stroke? Heat exhaustion is a more common condition related to excessive heat exposure. You may have heat exhaustion if you're experiencing nausea, increased sweating, fatigue, and a fast heart rate. Heat exhaustion may also cause fainting. If you believe you are showing signs of heat exhaustion, hydrate yourself if possible, but avoid any alcoholic drinks, which may increase dehydration. Move to a cool, air-conditioned place, remove any excess or tight layers of clothing, and take a cool shower, or apply cold compresses to your body. Most importantly, do not wait to prevent heat exhaustion. By acting quickly, your symptoms may recede. However, if you are excessively vomiting, seek medical attention. If you are experiencing heat exhaustion for an extended period of time, it can lead to heat stroke. Heat stroke can come on quickly if it is very hot or if you are overexerting yourself. That's why it's important to begin treatment at the first signs of heat exhaustion. Once you experience heat stroke, you will find yourself in a state of confusion or delirium. You may even lose consciousness. You will stop sweating, develop a headache, and your heart rate will rapidly increase. If you or another person develops heat stroke, call 911 immediately. This is a medical emergency. Try to move the person to a cool place quickly. Use a cold compress to reduce body temperature, and do not give fluids to someone experiencing heat stroke. Certain factors can increase your risk for heat exhaustion and heat stroke, though anyone can develop either condition. The following factors can increase your risk for heat sensitivity. Infants and children under the age of 4 and adults aged 65 and older are at increased risk for heat-related illnesses. That is because your ability to regulate temperature is much more difficult at these ages. Some medications used to treat high blood pressure or heart conditions may reduce your ability to stay hydrated. Dehydration can cause heat exhaustion and heat stroke. Your body retains more heat when you weigh more. It can also be more difficult to cool your body down if you are overweight. When you rapidly move from a colder to a warmer climate, such as going on vacation in a hotter location, your body may not be able to adjust to the warmer weather. You may have more difficulty regulating your body temperature as a result. Heat index is a measurement that factors in humidity along with the outside temperature to determine how hot it feels to you and your body. If the humidity is high, your sweat evaporates more easily and you may have a harder time cooling yourself down. If the heat index is greater than 91 degrees, you should focus on prevention methods. Your doctor will likely be able to diagnose heat exhaustion or heat stroke based on your symptoms, but they may decide to run tests to confirm the diagnosis or check for complications. A blood test may be used to check your sodium or potassium levels to help determine if you are dehydrated. Muscle function tests may be performed. Your doctor also may run tests to check your kidney function. A sample of your urine may be taken. Dark yellow urine may be a sign of dehydration. X-rays and other imaging tests can be used to determine if you have any internal organ damage. With treatment, you can fully recover from heat exhaustion. Early intervention can also stop it from progressing to heat stroke. Experiencing a heat stroke is an emergency. If left untreated, it can cause damage to your heart, kidneys, muscles, and brain. Your risk for serious complications, including death, increases the longer treatment is delayed.